Yeah, so my name's Scott Gable. I'm Cellular Pathology and Mortuary Services Manager and the Lead Biomedical Scientist within Cellular Pathology for Cardiff and Vale University Health Board. So my day job is as the Lead Scientist for Cellular Pathology Services across Cardiff and Vale. So we have a site here at Dragon's Heart, UHL and UHW, and we also support the local Resilience Forum excess death store down in Cardiff Docks. The role is split. I look after the mortuary, which is care of the deceased, and I look after the histology laboratories, which are care of the living. And I think it's really important that we look at people in the same fashion. It doesn't matter if a person is dead or not. We treat them with that same dignity and respect.
My name's Claire O'Brien. I am an anatomical pathology technician. I've been doing the job 25 years now. Basically, the role is varied. We help with post-mortems, we release patients to undertakers for their funerals, and we try and do viewings for families wishing to see their loved ones after they've passed away. Having had to deal with COVID the last couple of months has been quite a trial for us down in the mortuary. There are 6 of us right now. We were told fairly early on that the hospital was going to have a no visitor policy, which meant that our viewings were effectively stopping, and to have to speak to relatives on the phone who are not allowed to come here to see their relatives, and then to tell them they're not allowed to come in and see them after they've passed away. It's hard, it's heartbreaking for the family, and it's not very nice for us. My colleagues have decided to make a wall outside the mortuary. We're going to put some trellises up on the walls outside the mortuary. We are going to colour code some hearts into the shape of a rainbow, and every person that's passed away since lockdown began, their initials and their date of death will be put on a heart and put outside. So there's a memorial wall outside for families to know that they did matter and their relatives were respected and they were taken care of when they were here in the mortuary. I think the Welsh public have been fantastic. They've adhered to the stay at home, stay safe, save the NHS. We've been very lucky as we haven't had it as bad as we thought we were going to be affected. And so we've just got on with it, and I'm sure every other department in this hospital will say the same. They just get on with it because that's their job.
I would like to be able to say thank you to everybody within cellular pathology, and that's every member of staff, not just those that we see as frontline cutting edge, so not just the APTs, but all of the support workers as well, the A&C team, the scientists. We've all pulled together, and I think that's a real credit to all of us.